October is National Liver Awareness Month, and here to talk about fatty liver disease is Dr. Sonia Olson with Tampa General Hospital. Doctor, thank you so much for joining us. A lot happening in October, so we want to make sure that we get this topic heard and talked about. So talk about non-alcoholic fatty liver disease, because when you think of liver disease, you do always think of alcohol.
Correct. Well, thank you for having me, Erin. Non-alcoholic fatty liver disease is what it sounds like. It is the fat that's deposited in the liver, not related to alcohol, but usually due to genetic and metabolic conditions.
So what can we do to keep ourselves healthy? Is it all about diet?
Diet and exercise are the most important, but it's really important that people get screened for fatty liver disease.
Okay.
This is a silent killer.
Interesting.
1 in 3 Americans have fatty liver disease, and most of us don't even know it.
And so you mentioned it being hereditary. So it's just one of the many questions we need to ask our parents and our grandparents if it's something. And this shows up on a blood test, right?
There are blood tests that can alert us to the presence of fatty liver disease. We actually have new guidelines that are endorsed by liver doctors and endocrinologists, and we know who needs to be screened. So anyone with diabetes, anyone with 2 cardiac risk factors, such as high blood pressure, high cholesterol, obesity, certainly anyone with elevated liver tests, and anyone who was found to have fat in the liver on an imaging study needs to talk to their doctor about next steps.
And you're looking at some of the symptoms. That was going to be my next question. How do I know if I have, or if I should be alerting my doctor if I've not been tested? And you see them here, you know, some pain in that area, tiredness, loss of appetite, weight loss. Those are all symptoms.
These are all very scary symptoms, but unfortunately, most people with fatty liver disease don't even know they have it. And because of this long period of being asymptomatic, it's really important for people to talk to their doctor if they're at risk, if they have any of those diseases we talked about. What they need to do is get their liver tests checked, and we calculate a score called a FIB-4, and that alerts us if there could be scar tissue in the liver. If they have an elevated FIB-4 score, then they need to get referred to someone like me, a hepatologist or gastroenterologist, for the next step in testing.
Can you get better? If you go to a doctor and they say, oh, wow, you know, we're seeing some high levels and things aren't looking good, can we reverse this?
That's a great question. The answer is yes, and that's the big push behind finding it early and people getting screened. While we do have some medicines that we use to treat fatty liver, the most important is diet and exercise. And weight loss, as hard as it is, even weight loss of 5% can have significant implications for the liver.
Wow, that's
so
great.
There's a lot of hope.
Okay, so add it to the list of things to kind of be aware of when we're talking to our doctor, especially perhaps if you've put on some extra pounds after COVID and so forth. So good information. Thank you so much, doctor.
Thank you.
Appreciate you raising awareness. I definitely learned something, that's for sure. If you want to know more about the new screening guidelines or fatty liver disease, just in general, we've put a link on our website, WPBF.com, so go check it out. Vanessa?
Thanks, Erin.